My name's Anna. So I'm going to tell you about my elective, which was in St Vincent and the Grenadines. So to make a start, I'll just tell you a bit about where St Vincent is and what I was doing there. Okay. Was it doing something? Okay. Maybe that's what it is. So St Vincent it's made up of the mainland, St Vincent, and the smaller islands of the Grenadines, which is 32, and it's found in the East Caribbean Sea. So I was based in just near Kingstown, the capital, in a village called Arnesvale. And my placement sort of consisted of going into the district clinics, which was a bit like GP here, doing health outreach events with the local people, and then spending a bit of time in surgery. So it was a bit of a varied elective, getting to see a lot of different things. So yeah, just as a brief overview. So as I said, I was based in Arnesvale and was seeing the patients there, but obviously there was a lot of free time and a lot of chance to explore the amazing scenery there, such as the waterfalls and volcanoes. We spent a lot of our free time actually going to the other islands. So going to, our favourite one was Bequia, and then there was Union Island as well. So you could just get boats out to them and then stay over there for a few nights. We got quite involved in all the culture there, trying out the sort of local cuisine. So what you can see in the middle is a dish called ital, which is a typical sort of Rastafarian dish. So there's a lot of, obviously there's a lot of fried chicken out there. So this was what their equivalent of like a healthy version of that. So it's soya instead of meat, and it's low salt, low sugar. So they were all raving about it because of its health benefits. So it was nice to try. And then a bit of swimming with turtles, and then me on placement as well, because that was obviously part of it as well. So I'm going to just talk about three sort of main events, the things that stood out to me. And this picture of me and my friend, one of the amazing things I loved about this experience was being able to wear flip-flops to placement. That was quite fun. So firstly, I noticed there was quite a lot of varied attitudes to healthcare, and in particular, I'll talk about the attitudes to sexual health and to diabetes. They'll talk about a surgical dilemma, so reflecting on an incident that happened in vascular surgery. And thirdly, just overall a personal challenge, so that was overcoming the struggle of the local dialect. So this picture was taken during one of the health outreach events with the local people, and this was specifically for women's health. So we did some health counselling, we did some blood pressure and glucose checks. We were able to chat with the local women. We gave out free bras, free sort of contraception advice, and those leaflets there on STIs and things like that. So this is where I really realised the differences in attitudes to things like sexual health and diabetes. So particularly with a lot of the school-age children who we spoke to, we realised that they'd been told that the best sort of method of contraception is abstinence, and they hadn't been told anything about what would happen when or if they become sexually active. So this just made me realise there's so much of a reduced awareness on sexual health and how it really is a taboo subject. And even though things have moved on a lot in the UK, it hasn't there. This also made me think about how lucky we are to have things like cervical screening, and we get sort of postal invitations for women on their, when they're 25, whereas there is no cervical screening programme, or I don't think there are any national screening programmes in St Vincent. So that just made me realise what a luxury it is to have things like that. So diabetes, it's one of the major health problems in St Vincent. And just speaking to a lot of the locals, they described it as a communicable disease. So they believed that when they didn't feel well, they would have their insulin treatment, and then after that they would be cured. So they would stop taking their insulin. So it just shows that there was a lack of awareness on the long-term consequences and on the fact that diabetes is obviously a chronic condition. So it's quite shocking to see that they didn't sort of understand that a lot of the time. And then I found out that there were no actual national targets for lowering blood sugar. So it shows it's not just a problem on a patient level, but also on a national level as well. So moving on from that, I'll talk a bit about some of my time in surgery. So this was mainly observational. I got to help out a little bit here and there, but the main surgeries were vascular surgeries. So I'll talk about this case. So there was a patient, she was 58 years old, and she presented with osteomyelitis and necrosis of her right foot, and she was a known type 2 diabetic. So her surgery was a transmetatarsal amputation and debridement, which was under local anaesthetic. So as you can see there, that was the plan for the surgery, and under local, it was quite intense. So unfortunately, the patient was all right at the end, but during the procedure, it was found that the infection was so bad that her nerves were so damaged that the local anaesthetic didn't actually provide her adequate pain relief. And then this sort of posed the dilemma to the surgeons as to whether to continue the surgery or to postpone to do it later. And they were worried that if they left the surgery too long, then it would just progress to sepsis and potentially the patient would completely lose her foot. But obviously for the patient at the time, she was in a lot of pain and she was asking for morphine, and it took so long to get the morphine, but by the time the nurse had come back with the morphine, the surgery was finished. And it was just quite a sort of shocking experience, and I felt quite helpless not being able to really, intervene or help or do much. And obviously it just felt, difficult for the patient to have to go through that. So yeah, in terms of reflections, obviously there was a lack of respect for the patient's wishes, and it made me realise that patients out there, they will be reluctant to seek help if they know that they could end up in situations like this. So just moving on, I'll talk a bit about personal challenge. So although St Vincent is an English-speaking country, the consultations were difficult because there was a lot of differences in the dialect and the mannerisms. And this is something I hadn't really realised before going out there, because I was thinking about St Vincent because it was an advantage that they spoke English out there. But once I was actually talking to patients and other locals, you realise that it's actually still difficult to converse with them. But overall, I think this will help with future careers, learning to adapt communication styles to different patients. And it's also just helped sort of remind me of the importance of avoiding medical jargon unless it's absolutely necessary. So just a few extra thoughts, really. So as I've said, this experience has just been amazing, and it's really helped me to see the difference in healthcare attitudes and the differences between the priorities and surgeries between UK and St Vincent. As I said, it's helped me build resilience, transferable skills, such as overcoming these barriers, and just a massive appreciation for what we have in the UK. And in the future, I'm inspired to pursue a career abroad and learn more about global health. Because I've always been interested in doing something like MSF or going abroad as a medic with Royal International, and this has kind of just solidified those ambitions to carry on doing medicine abroad. And I just want to say thank you, and a massive thank you to York Medical Society for making this possible and for your generous donation. Thank you very much.
Well, thank you. That was very interesting and quite harrowing experience by the sound of it. They've got a medical school. We used to have students from St Vincent and graded, didn't we? Wasn't that the same island? Have they got a big medical school, a big hospital?
They have a medical school in America. So there's a lot of students that come across from America to do their few years clinical in St Vincent. I can't remember exactly where it was.
Okay, so we have students in York Hospital. It was Grenada, was it? Grenada. Okay, right.
Okay.
Yeah.
St George's.
Oh, is it right? Yes, St George's. Right. Yes. So, because certainly then it was just a horrifying experience. The sexual health one, particularly, I think, is. Did they mind you talking and discussing sexual health with them?
I can't say it was the easiest thing to discuss. It wasn't that well received, but we sort of tried our best, and I think they took stuff away from it. I think they were quite happy to have events that were specifically for women's health.
Did the doctors and nurses mind you doing it?
With these events, they were run by a lot of the medical students, so there wasn't actually that much kind of overseeing from the doctors there.
Yeah.
So yeah, it was, I suppose, quite a bold move from us. Really.
Sorry, I'm hogging the floor here.
Sorry, I'm hogging the questions as well. I got the feeling it's not just you that found it difficult to talk to the patients. It sounds to me as if there's a general communication problem between medicine and patients
Yeah.
there. Is there a kind of big difference between rich and poor? You know, that map contained the island of Mustique, and I'm just thinking that is this like it was in Britain 70 years ago when the doctors didn't know how to talk to the patients?
Yeah, I think so, definitely. Yeah, there definitely is a big contrast between the rich and the poor. A lot of the people, I was quite surprised at the sort of conditions they were living in, but then close by there'd be people in these amazing palaces, and as you say, like the islands, Mustique and Martinique, they were all very luxurious. So there was, yeah, both ends of the spectrum, definitely.
Did the doctors and the nurses speak the same language as the patients?
Yes, most of the time. Yeah, yeah.
Okay.
You say there was a lot of diabetes.
Yeah.
Is that type 1 or type 2? If it, I know you mentioned the problem of the type 1 stopping their injections. Was there more diabetes in the population than in this country? And was the proportion of 1 to 2 different in than in this country?
From what I know off the top of my head, it was definitely more type 2 diabetes. And in terms of percentages, from what I know, there's probably a lot more out there. It was one of their major problems, and a lot of the patients we just spoke to would just mention that they had diabetes as well. I think also a lot of the lifestyle, there's a lot of sort of unhealthy eating, alcohol, and there's a lot of sort of, but just in general, I don't think the lifestyle is that healthy overall. This is quite generalizing, of course, but yeah, it kind of makes sense. There's a higher instance of type 2.
Were there any contacts with the French health services in Martinique?
The question was, were there any health contacts with the health services in Martinique?
I don't know. I don't think so. I'm not sure. Why do you ask?
Because they would be quite relevant. Possibly there would be a bigger range of services there.
Yeah.
And there wasn't in St Vincent.
Yeah. Yeah. There was definitely a problem with getting patients from different islands to the mainland. So some people had come really far from other islands, and then if one patient was really annoyed because he couldn't actually see the doctor, and he'd spent 6 hours on a boat to get there. So yeah, there's definitely a problem with the further out islands, just getting that kind of care. Yeah.
Thank you very much.
Thank you.
Very